Previously we started with a new lecture which is about nerve injuries of the upper limb. So basically we have spoke about the brachial lesions, okay? We spoke about the upper lesions and lower lesions, and we spoke also about briefly on long thoracic nerve injuries. So today we're going to speak about two nerves, important nerves, which are axillary nerve and radial nerve. We will speak about how they're injured and what happens when they're injured, and what muscles are affected when they're injured. Okay, so first thing we'll start with axillary nerve. So injuries to the axillary nerve, it can be injured by pressure to a badly fitted crutch. What do you mean by that? If a person, let's say, broke his leg, okay, and he went to get a crutch, okay, so hold his hand, and it's pushing under his armpit, okay, so a badly fitted crutch could also cause an axillary nerve injury. So let's say also downward displacement of the humerus could also cause an axillary nerve injury, which is also shoulder dislocations. So let's say here Mr. Skull had a dislocation in his shoulder. He could also have an injury to the axillary nerve if he had actually nerves. So paralysis of the deltoid. Basically, what does this supply? What does the axillary nerve supply? It supplies the deltoid and the teres minor, but you have paralysis of deltoid and teres minor, but usually teres minor is clinically not seen to be injured. Yeah, I don't know why too, but just clinically not seen. Anyways, shoulder dislocations can, as I said, injure the axillary nerve, and there will be loss of skin sensation over the lower half of deltoid muscle. So this is the lower half of the deltoid muscle, this is the upper half. In here, the lower half, there will be loss of sensation of the deltoid, of the skin over the deltoid muscle, and they will have basically paralyzed, wasted deltoid. What do you mean by wasted? Wasted, decrease in size, atrophied deltoid muscle, and you know, the greater tuberosity in the upper limb. Okay, in the osteology of the upper limb. If you palpate it in a normal human being, you won't feel it, right? But in here, because the deltoid is atrophied, it's smaller and it's wasted, well, you can feel it because of the wasting of the deltoid muscle. So for sure, what does deltoid do? Abduction of the shoulder. So basically, abduction of the shoulder is impaired, and paralysis of teres minor, as I said, it's not recognized clinically, but it should be paralyzed, but it's not recognized clinically. So now we finished with the axillary nerve, and we're going to start with injuries to the radial nerve. So radial nerve injuries, it can be injured by, let's say, also a badly fitted crutch. So a person broke his leg and he's holding a crutch like this, and it's really badly fitted. It could injure his radial nerve. At the same time, if a drunk person comes over and he passed out, he got like so drunk, severely drunk, and he had alcohol intoxication, and let's say he fell asleep while his hand is over the back of the chair, okay, and when that happens, it also gives an injury to the radial nerve, and at the same time fracture or dislocation of the proximal end of the humerus. So what is the proximal end? Of course, in here. So fracture of the proximal end of the humerus could also cause a radial nerve injury. So what muscles will be affected? You have to think, oh, what muscles does it supply? So if it's injured, the muscles that it supplies will be affected. So what muscles does it supply? Let's say the main muscles, which is triceps, and there's another muscle I didn't talk about because it's basically not important. You could put it in your bank of knowledge bank, okay? And this muscle is called anquios muscle, okay? Anconeus muscle, which is, let me show it to you, the anatomical position of it, okay? So in here in the elbow, we have the olecranon process, and here we have the lateral epicondyle. So moving this way, we have muscle, which is called anconeus muscle. So this one will also be basically injured because it's supplied by the same nerve. And we have the long extensors of the wrist. They'll also be paralyzed and unable to extend. He won't be able to extend the elbow and wrist joint and fingers. So extension will be like this. He won't be able to extend all of them together, okay? So we'll have something called wrist drop, like this. He can't wrist drop, or you could say flexion of the wrist occur. So when the opposite muscle stops acting, okay, when the opposite muscle stops acting, the opposite effect will be there. So you could say it in this way. And he won't be able to flex his fingers firmly, okay, for, let's say, gripping. Let's say a guy who wants to hold a cup, okay, he can't flex it firmly or grip really well, okay. So brachioradialis and supinators are also paralyzed. About supination, check my previous videos of the terminology. You will know also which muscles do supination. And what do we see in sensory nerve findings? What do we see in sensory to make sure that the radial nerve is injured, not any other nerve, okay? We have a little loss of skin sensation over the posterior surface of the lower arm, okay? Lower part of the arm. So basically, this is the posterior surface, okay? So the lower part of the arm, you have little loss of sensation over there. We have loss of sensation in the lateral part of the dorsum of the hand. So dorsum of the hand, lateral part, okay? And sensory loss of the dorsal surface of the roots of the lateral 3.5 fingers. Lateral, this is the lateral anatomical position. You stand like this, or the cadaver stands like this, okay? And you have these lateral 3.5 fingers will be all paralyzed, or you can say that, you'll have loss of skin sensation over it. Anyways, so we have this is the superficial branch. Now we have the deep branch. What happens in deep branch when it's injured? So it can be damaged by, let's say, fracture or damage in the or fracture in the dislocation in the proximal end of radius, or radial head, let's say. So let's say a woman or a mother is holding her child, and he's crying and whining, he wants that toy or something, okay? And she comes and holds him like this and carries him from his hand. Well, this is actually a mistake, because the radial head, this is the radial head, this one can get dislocated, okay? There is a fascia which holds it, or a sheath which holds it, or wraps around it, so it can dislocate and go outside that sheath. So this would cause also other manifestations, okay? So there won't be any wrist drop in here, as there is extensor carpi radialis is undamaged. So because extensor carpi radialis is undamaged, you will not have wrist drop. And there won't be also sensory loss, because basically this is a motor nerve. So the deep radial nerve is a motor nerve. So that'll be it for today. Next class we'll be explaining several other nerves. And I hope you understood it well, and thank you.